Hello, and welcome to this edition of Cancer TV News. I'm your host, Belinda Pinello. This broadcast will focus on breast cancer. We'll review a new study signaling the link between hormone replacement therapy and the risk of breast cancer, look at vitamin D as a cancer-fighting agent in breast and colon cancers, and we'll see if breast changes can reveal whether a treatment is working. New findings show a strong relationship between taking menopause hormones long-term and developing breast cancer. The federal study reveals the most dramatic evidence yet of the dangers of these still popular pills. Women in the study who took the pills for 5 years doubled their risk for breast cancer. Even women who took estrogen and progestin pills for as little as a couple of years had a greater chance of getting cancer. The good news is that when the women stopped taking them, their odds quickly improved, returning to a normal risk level roughly 2 years after quitting. Researchers from the Women's Health Initiative advise that women can still diminish their risk, even if they've been on hormones for a long time. They tested estrogen and progestin pills that doctors long believed would prevent heart disease, bone loss, and many other problems in women after menopause. They quickly saw increases in heart disease and breast cancer and stopped that portion of the study. This research emphasizes the use of hormones only if symptoms like hot flashes are severe and at the lowest dose and shortest time possible. Even so, most women will not get breast cancer by taking the pills short term. This risk accumulates with each year of use, though. Most women should be able to discontinue hormones in 3 to 4 years, or at least reduce their dose, one of the lead researchers commented. Please consult with your healthcare provider before deciding to make any change to your current hormone treatment therapy. Does vitamin D fight cancer? That's what researchers at the University of California tried to find out. They used data on average wintertime blood levels of vitamin D and rates of breast and colon cancers in 15 countries. Rates of the diseases tended to fall as average vitamin D levels increased. People living above 37 degrees latitude, such as the northern U.S. and Canada, are considered especially at risk. Researchers say that if Americans were able to maintain adequate vitamin D levels, many cancer cases could be prevented annually. 60,000 cases of colon cancer and 85,000 cases of breast cancer. The government recommends 5 to 10 micrograms of vitamin D per day. That's equivalent to 2 cups of milk for an adult. However, the biggest source of vitamin D is the sun, which stimulates the skin to make the vitamin. But sunlight presents problems such as overexposure, skin damage, and skin cancer. The American Cancer Society says the best way to get vitamin D is from food and a daily supplement, not the sun. Too much of the vitamin can lead to a buildup of calcium in the blood, leading to kidney, heart, and bone problems. The American Cancer Society recommends talking to your doctor before adding any vitamin D supplements. And finally, it may be possible to predict which breast cancer patients will be helped by tamoxifen based on changes in their breast density. Women with dense breasts, a term meaning they have more non-fatty tissue, are known to have a higher risk of breast cancer. British researchers suggest that lowering patients' density using tamoxifen also lowers the chances tumors will come back. Tamoxifen is a chemotherapy drug for breast cancer that patients take in pill form. It has been used for more than 30 years to treat breast cancer in both women and men. In this study, women whose breasts became noticeably less dense after a year or so of taking the drug had a 63% reduced risk of breast cancer. Researchers note that it is important to find a way to predict who will respond to tamoxifen. Changes in breast density may help in this way. About 10% of women have dense breasts, which are harder to read on mammograms. However, there is evidence the tissue in their breasts may be more cancer-prone. Researchers also note that women with dense breasts are typically at 4 to 5 times the risk of developing breast cancer than women without them. That ends this episode of Cancer TV News. Thank you for joining us, and we look forward to seeing you next time.